Hey, Dr. Amy here. Getting a port for chemotherapy, it's scary. If you've never had any type of surgery, then this can feel pretty overwhelming. The good news is that there are some pretty easy and simple steps that you can take to make this process not only safe, but a lot more comfortable. In this video, I'm showing you 7 things that you need to know about getting a port for chemotherapy. Starting with number 1. Why do you need a port? The main advantage of having a port is that you won't need a bunch of needle pokes or sticks every time you go for chemotherapy or a blood draw. This port can be used for both. The nursing staff won't have to poke you numerous times to try to get access to a vein because they can just use the port to quickly access. If you're anything like me, then getting access to your veins is really tricky for nurses or lab staff. The port makes this process really quick and easy. You'll be getting 1 needle poke for every time the port is accessed, but I'm going to share with you how to avoid even that towards the end of the video. Okay, but that leads me to number 2. What is a port? A port looks like this. A port is about the size of a quarter, and it's a device used to deliver medication straight into your bloodstream. They're typically placed in your chest or in your arm. Now, this is a semi-permanent device to help you get chemo. Ports can stay in place for months or even years, and then once the chemo's done, the port can be removed. They consist of a basin sealed with a soft silicone top, and then they're connected to a catheter that goes straight into your bloodstream. Okay, but on to number 3, how is your port put in? Getting your port placed is a fairly simple procedure. The pre-surgery process involves minimal hassle, minimal prep, and some fasting instructions. When I got mine placed, I was in and out. I experienced minimal pain, which was mainly just soreness, and it was easily managed with ibuprofen. I did shed some tears during this procedure though, but that was all emotional for me. For me, this was the point where chemo felt really real. I didn't want to do chemo. I don't think anyone does. I didn't want to lose my hair, but I needed to move forward. I allowed myself to shed a few silent tears during the procedure, but of course the nurse noticed and she was really compassionate about it, which I really appreciated. After the procedure is completed, then an x-ray is done to make sure that the port is in the correct position. And that's it. You'll be awake for the entire procedure, and it usually takes about 30 to 40 minutes. Okay, but what about after the port is placed and you're healed up? Can you swim? Can you take a bath? Can you work out? That brings me to number 4. What does it feel like to have a port? Most of the time, you won't notice anything. You won't feel anything at all. This is why a lot of people like to have a port. If you press against your skin, you'll feel the hard circle and you'll be able to feel that it's there. For me, I did notice my port quite a bit. If I bumped against the couch or in the car, I would notice it right away. Okay, but that brings me to number 5. What can you do with a port? After the incision from the port placement has healed, you can do pretty much whatever you want. You can do everything like you used to. You can swim, shower, or bath with your port. You don't really need to take any special precautions. You can work out or exercise like you used to. That includes lifting weights if you want to, or even doing upper body exercises. This is all safe to do with your port. My port was placed in my arm and I continued to lift weights, do yoga, and run with my port put in place. But that brings me to the next thing that you need to know about a port. Why are some ports placed in the arm and others are placed in the chest? There are pros and cons to each spot and each procedure. That's why you may see that different centers or different clinics take different approaches. Some centers prefer arm placement because it's more aesthetically pleasing and easier to hide. It's easier to hide a scar on your arm than one on your chest. Arm ports also have a slightly lower infection rate and are generally a little less expensive to place. And both have similar risks of complications, which brings me to the next thing that you need to know about a port. What are the potential complications? Anytime you have a surgical procedure, there are potentially complications. There is a risk of an infection, but it's really low. The main risk that many cancer survivors are aware of is the risk of blood clots. This was unfortunately something that I experienced when I had a port. Blood clots can be caused by your port. They do tend to happen less frequently in the chest port placement versus the arm placement. And the symptoms of a blood clot were not as clear as I thought they would be. I had some mild swelling, but I thought it was swelling from the procedure. But when I went to go see the nursing staff, they flagged it right away. I didn't have any redness and it wasn't hot to the touch, and both of these can be a sign of a blood clot. If you have pain in your arm, your chest, or your back, that could also be a symptom of a blood clot. Now, having a blood clot when you have a port is obviously not something you want. But don't worry, they are quite rare. It did happen to me, but that does not mean it's going to happen to you. Oh, and that brings me to one more thing that you absolutely need to know about having a chemo port. You need to get some lidocaine cream. Lidocaine cream or ointment is generally prescribed, but it's something you can get to apply to your port site before they do a blood draw or a chemo poke. Now, a needle poke to access your port is really not all that painful. But when you're going through cancer treatment, why go through any extra pain or discomfort than you have to? So I use lidocaine cream to get rid of any pain or discomfort from any needle pokes into my port. You apply the ointment for 20 to 30 minutes before you're about to get poked. You'll be able to feel on your skin where the port is located. Apply the ointment and it'll gradually numb the area. The best way to use lidocaine to numb the area is to put a bunch of ointment over your port area and then cover it with plastic wrap, like press and seal. This allows for all that numbing to take place, and when you take off the press and seal, it doesn't hurt like a bandage. Now, accessing your port is done with a specialized needle and a specialized technique. It's crucial to note that nurses should be specially trained on how to access your port. Chemo nurses do this all day long, so they're excellent at it. But if you end up going to a regular lab or to the emergency room, then they may not know the technique that they need to use. This is exactly what happened to me when I ended up going to the emergency room between chemo cycles because I had a fever. The nurses there, they didn't know how to access my port, so I ended up getting poked quite a few times. Eventually, they called up to the chemo ward and had a nurse come down, and she was quickly able to access my port. There's no reason why this should happen to you, so just be sure to ask before they start poking. But overall, having a port during my own cancer treatment was a game changer for me. It made the process so much more manageable. It saved me a lot of discomfort and a lot of pain. Okay, but now that you know about chemo ports, the next thing you need to know about is all about chemo. That's why I'm linking up this next video here on chemo secrets. Click the link here. I'll see you in the next video.